So my name is Richard Hindley, and I'm going to talk to you today about a very common condition called prostatitis. There are varying types of prostatitis. Acute prostatitis is usually caused by infection, and its presentation is very acute, often resulting in hospitalization. And there is a requirement for antibiotic treatment. But if I focus on what is much more common, which is chronic prostatitis, which might be due to bacterial infection or it might not, and something called chronic pelvic pain syndrome. And we can think of them as a collective number of sort of diagnoses. Symptoms can be very vague and it can often mimic other health conditions, but typically it affects men aged between 30 and 50. It can affect younger men and older men, but it's typical, particularly in men aged 30 to 50. And it might just arrive with some discomfort in the perineum, the area behind the scrotum, or discomfort in the bottom or lower back or suprapubic, lower abdominal area, or discomfort in one or both testicles or the penis. There may also be some discomfort when passing urine, and it may impact on the urinary symptoms, making men go to the loo more frequently. It can get mixed up with the symptoms associated with benign prostatic obstruction, and sometimes they can coexist because they're both very common conditions. Men with chronic prostatitis or this chronic pelvic pain syndrome, they need to be evaluated with, we will do a urine test to exclude the bladder infection. We might well do an ejaculatory fluid sample to be sent off for analysis. We would typically organise an ultrasound scan with a flow test, and we will be listening very carefully to each individual patient's symptoms and what their triggers are, because I think there are multiple different causes of prostatitis, and it's a condition that's relatively ill understood. But it's really about listening to each individual's symptoms and then trying to arrive at a way of treating those symptoms. So we would do an evaluation as I've discussed, listening for, are the problems predominantly urinary symptom related? Is it predominantly discomfort related? Is it a bit of both? I did, for example, once have a man in his late 40s who just presented with spontaneous urinary incontinence, urinary leakage with no obvious explanation. And in the end, by process of elimination, we realized that this was prostatitis, and we treated him and his symptoms responded very quickly. So in terms of the treatment of prostatitis, chronic prostatitis, if we believe that there is a bacterial infection, which is perhaps only 10% of cases, then we would treat with a course of antibiotics. And these would have to be antibiotics of a type that's good at getting into the prostate gland, for example, trimethoprim or ciprofloxacin. Antibiotics such as nitrofurantoin or penicillin, amoxicillin are really not as good at getting into the prostate gland, and so the patient may not respond. I think bacterial prostatitis can occur after an acute urinary tract bladder infection that's relatively uncommon in men, and they have a short course of the standard antibiotics, and then the bacteria go and hide in the prostate and so that the symptoms continue, and a second or third course of antibiotics is required. So if we believe bacteria are implicated, we give antibiotics, having done an initial evaluation. Sometimes we'll proceed to organising a cystoscopy, which is a local anaesthetic inspection of the lower urinary plumbing. But sometimes we'll do this under a general anaesthetic with something called a prostate massage. This can be helpful, particularly for men that have had antibiotics early on. And let me also explain that some men that haven't had an infection or haven't got a bacterial proven infection will still respond to antibiotics. And we don't really understand the reasons for this, but we think the antibiotics may be having an anti-inflammatory effect. And we may often, extend the course, not just from 2 weeks, not even to 4 weeks, but sometimes as long as a 6-week period of antibiotics really seems to be able to bring the symptoms down to a much lower level and make them more manageable, or indeed allow them to disappear completely. So extended courses of antibiotics are very beneficial. But if we've had some extended course of antibiotics and the symptoms return, they can easily come back again 6 months or a year later. They're often not as bad as they were at the initial presentation. But if they do recur, then we might consider having a look with a camera under an anaesthetic and rubbing and massaging the prostate gland, the theory being that we're washing out any debris or infection within the prostate gland. And that can be certainly beneficial. Sometimes we give medication to help with the urine flow. Sometimes in the acute setting, we'll recommend anti-inflammatory painkillers. And it really is a condition that for some men can be hugely debilitating. And it's often neglected and not really at the forefront of most primary healthcare practitioners' thoughts when they see a man with discomfort in the perineum or troublesome urinary symptoms. So it's a really important diagnosis to make, and one that we can really make a difference with the appropriate treatment. Sometimes also the pelvic floor can go into spasm, and that can be a problem. So stretching exercises, Pilates, yoga, those sorts of things can also be very beneficial. So thank you very much. I hope that was helpful.